My name is Dr. Luba Domenko. I'm director of the Preclinical curriculum here at Albert Medical School, and I work pretty closely with our students, particularly in their first and second years. It's one of the things we're proud of at Albert Medical School. We have an integrated preclinical curriculum, and what we mean by that is that I think of it as being a learner-centered curriculum. What should come first? How can we build on that? And we really pay less attention to what the discipline or the department is that's teaching that course, but rather we have our faculty work together to be able to actually design curriculum that makes sense to the students and really lets them figure out how the pieces work together. The Brain Sciences course is also a great example because not only do we have the basic science integrated across the basic science, but it's also integrated with anatomy because they're doing head and neck dissections during the time they're actually studying the brain and the neurologic pathways. And they're also learning their eye exam, head and neck exam, and neurologic exam in doctoring, our clinical skills course, while they're dissecting an anatomy and while they're learning about the pathways and the disease processes in the rest of the integrated curriculum. We have a great doctoring program. We get our first year medical students out to work with a community mentor in October of their first year.
Doctoring was definitely the biggest standout for first year, mostly because it was the biggest departure from what I had experienced before. But for doctoring, it's the first time you're really out in the community and you're speaking with patients, you're gathering what information you can based on your level of education. And you feel like you're actually part of what you're really aiming to go for. Like you really are helpful as part of that medical team. And it's a really good feeling. It's the first time you feel more like a professional than a student.
Students end up doing 2 half-day sessions a week. One half-day session is didactic. You're matched to two faculty members actually, an MD and a socio-behavioral scientist who work with a very small group of students in developing professional skills and in developing your clinical skills. And then the other half-day a week in the afternoon is spent you're matched to a community mentor and you work with that physician throughout the entire year. Our students have a lot of input on the curriculum, both in leadership capabilities. So for example, we have students on the MD curriculum committee as well as on the subcommittees for years 1 and 2, for example, that I chair, as well as the subcommittee for years 3 and 4. We have a lot of student feedback on our course evaluations and lecture evaluations.
There is a focus group after every single block from the get-go. Luba Domenko, the head of the first year curriculum, made it very clear to first years when I was a first year that if there's anything that needs to be changed about the curriculum, any suggestions that we had about the curriculum, their office was always open and they walked the walk. They didn't just talk the talk.